Another flu season will soon be upon us, and millions of healthcare workers will be forced to take the influenza vaccine or be threatened with job termination if they do not comply. The question needs to be asked, is the flu vaccine effective in preventing influenza illness and transmission? What this video will demonstrate using scientific evidence: number one, the flu vaccine is ineffective and is a scientific and public health failure. Number two, the flu vaccine has demonstrated to have a negative efficacy by increasing the risk of influenza illness. And number three, per HHS and CMS, vaccine mandates are coercive and deny informed consent. The first study we'll be looking at is published in the Cochrane Library. The Cochrane Library is considered the gold standard of evidence-based medicine, and medical institutions will use the Cochrane Library to set forth policies within their institution. The title of this study is Vaccines for Preventing Influenza in Healthy Adults, and they concluded, this analysis included 52 studies with 80,000 subjects, and there was no substantial statistical reduction in influenza illness. The absolute risk reduction was only 1.4%. Moreover, this study also found no significant effect of vaccination on working days lost or hospitalization. The next study we're looking at, also published in the Cochrane Library, titled Influenza Vaccination for Healthcare Workers Who Care for People Aged 60 or Older Living in Long-Term Care Institutions. And they concluded, the meta-analysis showed no significant difference in influenza, lower respiratory tract infection, or hospitalization for respiratory illness. Thus, there is no evidence to date that vaccinating healthcare workers will indirectly reduce the influenza infection in patients in long-term care settings. Another study I'll be looking at, published in Open Forum Infectious Disease, titled Mandatory Flu Vaccine for Healthcare Workers Not Worthwhile. This study was published in 2022, and the author of the study is Dr. Edmond. Dr. Edmond is the Chief Quality Officer for the University of Iowa Hospitals and Clinics, and he did extensive research on the flu vaccine and came to this conclusion. The SHIA's recommendation for making influenza vaccination a condition of employment has no more evidence to support it today than when it was published in 2010 and should be withdrawn. Another study I'll be looking at, published in Cell Host and Microbe in 2022, titled Rethinking Next Generation Vaccines for Coronaviruses, Influenza Virus, and Other Respiratory Viruses. Of interesting note, one of the co-authors was Dr. Anthony Fauci. These authors also did a very significant research review on the influenza vaccine and came to this conclusion. The influenza vaccine has had little improvement in preventing influenza infection and has been a scientific and public health failure. Another interesting study coming out of Cleveland Clinic, what the Cleveland Clinic did is they tested both vaccinated and unvaccinated employees during the 2024-2025 season. And the title of the study is Effectiveness of the Influenza Vaccine During the 2024-2025 Respiratory Virus Season. And what they found out is employees who were vaccinated with the influenza vaccine had a higher risk of influenza when compared to unvaccinated employees. Again, that was significant. These employees were mandated to take the vaccine and were threatened with job termination if they did not, but the vaccine they received actually increased their risk of getting the influenza virus. Another thing we'll be looking at, it was a petition done by a law firm to the FDA. The law firm is Surrey and Glimstead, and they petitioned the FDA concerning pertussis vaccine and regarding transmission and infection. They wanted the FDA to put a label on the pertussis vaccine saying that it does not prevent transmission, and the FDA's response was rather significant. What the FDA admitted is it's important to note that the FDA's licensure standards for vaccines do not require demonstration of the prevention of infection or transmission. There is no requirement that the vaccine also prevents infection with the pathogen that can cause the disease or transmission of the pathogen to others. Again, that's significant. So we're told to get the vaccine, prevent transmission, but the FDA is extremely clear that licensure standards for vaccines do not require demonstration of prevention of infection or transmission of the virus. Another interesting thing we're going to be looking at was a memo sent out by the HHS, Health and Human Services, in August 2025. And the title of their memo is HHS CMS Eliminate Financial Pressure Tied to Hospital Staff Vaccination Reporting. And the quote, Health and Human Services Secretary on 8/20/2025 announced the repeal of the federal policy that financially rewarded hospitals for reporting staff vaccination rates and an incentive that was coercive and denied informed consent. In the same memo, quoting both Secretary Kennedy and Dr. Oz, Secretary Kennedy made these comments: medical decisions should be based on one thing, the well-being of a person, never on a financial bonus or government mandate. Doctors deserve the freedom to use their training, follow the science, and speak the truth without fear of punishment. And Dr. Ross made these comments. Doctors and other providers should have the same autonomy to choose what's right for their own individual health care needs as for the patients whom they care. Today's announcement helps put the power back into their hands. This is very interesting. The HHS and CMS basically come out with a statement that vaccine mandates violate informed consent. In summary, the influenza vaccine's efficacy can no longer be supported by evidence-based medicine, and if no longer supported by evidence-based medicine, then it would seem it has more in common with a religious belief than scientific facts. The evidence presented has demonstrated the flu vaccine is ineffective in preventing influenza illness and transmission. The Cleveland Clinic study has demonstrated that it has a negative efficacy by increasing the risk of illness. Per the FDA, licensure standards for vaccines do not require demonstration of the prevention of infection or transmission. And per HHS and CMS, vaccine mandates deny informed consent. Again, the question must be asked, why are medical institutions still mandating the flu vaccine as a condition of employment?